Welcome to Rethink Health's Pathway for Transforming Regional Health. Today, many leaders are working to transform health in their region, and we find that they're all struggling with the same set of questions. What are the key steps that I need to take to move from a fragmented healthcare system that focuses on sickness to a whole system well beyond just healthcare that promotes better health, better care, more productivity for all? And how can our change efforts be sustained long enough to bring about those positive results? Like you, leaders want to know, what are the key lessons to be learned from others who've traveled along this path? What do the different phases look like, and what gets in the way? How long is it going to take to see any measurable impact? And finally, how do I move forward, build momentum, and make progress towards our goals? We developed this pathway for transforming regional health to address exactly these questions. Groups of leaders are looking for guidance. They're looking for a pathway that they can navigate and follow in a logical way, so that working with others in their region, they can truly transform their health system in significant ways. They want to see what leads to momentum, what pitfalls to avoid, and they want to look ahead to the future to see what's possible if they don't go astray. Through our partnerships with leaders and groups across the country, we've found that ambitious regional transformation efforts require three key ingredients. These are the three core pillars of the pathway. First is broad-based stewardship, leaders in regions who work together as stewards of a common system across boundaries and across their vested interests. Second is a sound strategy, agreement on a clear course of action for the region with priorities that will deliver the intended results over time. And the third is sustainable financing, identifying and allocating a broad range of resources to match long and short-term priorities. We've developed this pathway as a tool for leaders to use to help them move forward. It's based on our own years of experience working on complex system change, and it also reflects patterns that we've seen with leaders who have begun this journey in a range of communities around the U.S. This tool is meant to help leaders assess their progress, determine where they are on the journey so far. Our intention is to provide some guidance about what we've learned so far, but also to be candid about how much the details will differ from region to region. We want to be clear that transforming a system is an ongoing process of learning, experimenting, failing, learning some more, figuring things out along the way. It's not a process of making a strategic plan and executing that plan. So, with that in mind, let's take a look at the overall structure of the pathway and its component parts. First, where do we start? Or, are you ready to start? The Rethink Health pathway begins when leaders step outside their own organizational boundaries to work collaboratively with others. Chances are, if you're tuning into this lecture, you're not just interested in incremental change. You're aspiring to reach a radically better system where people are genuinely living healthy lives, they're getting superb care when and where they need it, and they're trying to identify smart, balanced, and sustainable investments for health and well-being in all places. You want your community to thrive. This pathway is headed toward that future state, but it will demand a very different pattern of organizations, relationships, and investments than what exists right now, and it will require regional leaders from multiple sectors to steward the local resources on behalf of a better future, not to advance their own special interests. We've identified 5 key phases that groups on the journey need to pass through on the route to health transformation. The route is not a linear one, so we represent it as a crooked line. And we've identified pitfalls that often keep collaboration stuck in a particular stage or that force them off the pathway entirely. We also show what builds momentum and enables groups to move to the next phase and make progress towards a bigger goal. Actions that, for example, increase demand for change by those involved, or enhance the capacity to engage in more and bigger changes, or that create alignment across the organizations and sectors that are part of the effort. So let's begin with phase 1 of the pathway. Phase 1 we've seen is typically a single focused campaign. Often groups are looking to solve an urgent problem, such as creating access to care for the underinsured, or pursuing a broader goal like creating a forum to develop collaborative approaches to improving self-care. The main attribute of this phase, though, is that a variety of well-positioned leaders from different organizations work together to accomplish a single goal or to solve a single problem. The campaign phase represents an intense collaboration that's short-term, and it usually ends once the goal is reached. So the typical pitfall of this first phase is that the effort fails to move beyond the initial goal because there is no vision of going beyond solving a targeted problem. The regions that we've seen that keep the momentum going and move beyond just a single campaign are the ones who choose a campaign and see this as the first step in an ongoing collaboration to a much bigger goal. One real example of a targeted campaign is a region in which public health workers, doctors, social services agencies, and community organizations work together to reduce hospitalization of children who have asthma, and they created a whole new way of supporting home care for those children. So those regions who keep moving on the pathway into phase 2 choose a campaign that brings a broad array of leaders to the table who can together bring the resources and the power to improve the whole system. And they use this initial project as a means of building their ability to work together. In the second phase of the pathway, a diverse set of stakeholders engage with each other in an ongoing forum. They work together towards building some shared aims for the system and coordinating efforts that different organizations can make. They're identifying and launching small-scale experiments that can build capacity and trust across sectors. But a typical pitfall of the engage phase is that there are not senior enough leaders at the table who have the authority to really commit organizational resources or to make the joint work a priority. The result is that the impact and focus of the work can be minimal and narrow. But we've also seen that in regions that sustain momentum through the engage phase, there's a real leadership team who are willing to jointly develop a bold vision for improving the system. They start to use their authority to invest in shared infrastructure to sustain a collaboration toward achieving that bold vision. For example, in one region, we saw a group of leaders from hospitals, from public health, and from the community convene to create new ways for the underinsured to access care. Once they had created and resourced the new clinics, the senior leaders handed them off to operational leaders to continue to run them. By itself, that's an example of a campaign. But in addition, these senior leaders continued to convene. They recognized that this first collaboration around the underinsured had opened the door to ongoing dialogue among them about other ways that they could work together to radically improve the system. These leaders began meeting regularly to decide what else they could accomplish as a team. And it's that enduring engagement that's characteristic of the engage phase. In the third phase, stakeholders are well along their way in working together across organizational boundaries. We call this third phase the align phase because collaborative efforts in this phase are focused on aligning their efforts sharply around a handful of clear, measurable, and high-priority goals. Align phase efforts are all about building widespread engagement to support a shared action agenda. They stimulate or they connect a wide array of initiatives, and they have a solid infrastructure in place for coordinating and buttressing all of these activities. The main pitfall of the align phase is that the low-hanging fruit has already been harvested, so now it becomes difficult to take on the bigger challenges. The stakes are much higher in the align phase, and it takes more resources to accomplish shared goals. In many efforts, collaborations will stall or they'll even retreat as they approach these harder questions. Groups that have overcome these hurdles and moved beyond the align phase have been able to up the ante. They've built momentum by calling for more audacious goals, by recruiting more champions, by inviting more local leaders to participate, and by focusing collectively on learning. One example of a region in the alignment phase was a diverse mix of organizations who have worked together to address hotspotters. And they've also worked together to reduce hospital readmissions, and they've launched initiatives to support aging in place. This particular leadership group has hired staff to support the coordination of these shared efforts, and they're deciding on shared priorities to pursue together over the next 5 years. What makes this a classic Phase 3 effort is the increasingly sharp focus on a set of shared priorities and a growing view of the regional health system as a system of interrelated parts. When groups get to the fourth phase, they're poised to redesign. The redesign phase is a step change from the align phase in multiple ways. The work of the redesign phase of the pathway is to engage in high-impact transformation efforts of the basic structures and systems, like incentives, like building new partnerships and devising new business models. The redesign phase also involves seeding and spreading disruptive innovations that can alter organizations in fundamental ways. In the redesign phase, we see leaders transforming key processes, and the organizations are working together toward clear, system-level goals. In the redesign phase, they use shared measures and data, and they draw on pooled resources that they have invested together. The main pitfall of the redesign phase is that it becomes clear that redesigning will produce new winners and losers in the system, and this leads to resistance. Innovations can conflict with the success or the growth of key stakeholders that have participated in the effort up till now. To build momentum, regional transformation efforts need to keep the effort thriving by building new support and new energy for real transformation, by dealing candidly with the competing agendas, and by keeping everyone focused on success for the region as a whole. One example of a region that is successfully in Phase 4 is one in which shared efforts to reduce hospital readmissions have already borne fruit. Leadership are actively discussing thorny problems like excess hospital capacity. They've created programs that are addressing diabetes and asthma that were refined in pilots and that are now being adopted in new and different neighborhoods. And they also have fully shared data systems that are supporting coordination among providers. We call Phase 5 Integrate because this final phase of the pathway is really about integrating all of the lessons learned from the redesign efforts and pilots and experiments of earlier phases and making them a normal part of doing business in the health system of the region. At this phase, there's an established, sturdy, multi-stakeholder structure or structures that steer the whole health system. There are groups that set priorities for the region and that make mindful choices about how resources are going to be invested both for health and for healthcare. And at the same time, leaders are paying attention to the future needs of residents and keeping a focus on learning and on adaptation for sustained progress. The biggest pitfall here in the final phase is the complacency that can set in when groups have achieved success, or it can be the resistance to pursuing bigger gains because they're becoming much harder to envision. The key to sustaining momentum here is refreshing the vision, bringing on board new champions while maintaining the shared memory and intention of the bigger vision for the region. We have yet to see an example of a fully transformed regional system of health in the United States. So we look to other sectors such as energy, technology, or the environment, and we look to other countries like New Zealand or Scotland for inspiring illustrations of what might be possible for us in the long run. So, where are you on the journey to health system transformation? What pitfalls do you think might get in your way or might be showing signs of emerging now? What momentum builders are enabling your progress so far? And finally, what do you see as your own role in leading health transformation in your region? To explore these questions more deeply, you can turn to two tools in the stewardship guides that we've created to guide your work. The first is a tool called the Pathway Self-Diagnostic. You can use it on your own to consider where your region is on the pathway now and what might be needed to sustain momentum in your collaboration in the future. Or you can share it with a group of like-minded leaders to explore what's next. The second is called the Leading Change Reflection Tool, and it's all about you. Where do you see yourself fitting into the larger effort? What leadership role can you personally play in leading your effort further along the pathway for transforming regional health? You can find all the tools I named here in this presentation and many more